Archana Swami. I'm a Pediatric Hemato-Oncologist at the Lilavati Hospital in Bandra. A hemato-oncologist is somebody who deals with blood and cancer diseases in children. So today I shall be speaking on leukemia in children, which is blood cancer in children. It's a rare condition which is not often seen, but it is actually not picked up too soon by the general pediatrician because it is not very well seen. Leukemias or blood cancers are cancers which arise from the blood cells in children, and normally the types of blood cancers that we see may be acute or chronic. Acute is when they progress very fast, and chronic is when they take time to progress, or broadly they may be lymphoid, that is arising from the lymphocyte type of cells, or they may be myeloid leukemia, which is they're rising from the other than lymphoid cells that may be seen. And the reason why they appear in children or even in adults is not fully understood, but there are some factors which predispose. So there may be genetic factors which may increase the incidence of leukemia in these categories. It may be seen in the Down's children, where more cancers are seen, about 2 to 3 times more than in the general population. It may also be seen in a condition called the Leukemia syndrome, where the families have a large number of cancers, leukemias as well as solid tumors. Or they may be seen, the higher incidence may be seen in a child whose sibling has been diagnosed with leukemia. This is more in identical twins. There is an incidence of maybe 5 times, but the incidence is not increased if parent has had leukemia in the past. And or if they are exposed to radiation or certain chemicals, they may be seen so in a larger proportion if the child has received chemotherapy in the past, and they may get increased solid tumors, or they may get this type of leukemia called the acute myeloid leukemia. And another condition which causes increased susceptibility is if there is a disorder of the immune system. So certain immune conditions, for example, ataxia telangiectasia has a higher incidence of leukemia, or anything which disturbs the immune systems. For example, if the child is placed on immune suppression following an organ transplant, this immune suppression can give rise to leukemias. So how does this leukemia present, or how does this blood cancer present? So basically what we see is the blood cancer grows inside the bone marrow, which is inside the bones. And as it multiplies and grows, it pushes out the other cells of the blood, which ideally grow in the bone marrow. And these could be the blood cells. So if the blood cells are pushed out, or if they're squashed and taken over by the malignant cells or the cancer cells, they give rise to a lot of weakness, a lot of fatigue, and they can also push out the white cells. So these children can have susceptibility to infections, or they can have infections, or one infection followed by the other, or infections which don't respond to antibiotics, and they can have also suppression of the platelets. So platelets, because they assist in clotting, you see a lot of increased bleeding. They can have nosebleeds, and they can have patches of bleeding on the skin, which are called purpurate. Other than this, the blood cancer cells can go to the lungs, they can go to the liver, they can go to the spleen, they can even go to the testicle, and they can even go to the central nervous system, which is the brain and the spinal cord, and cause symptoms because they are there. They can, in certain types of lymphoid cancer, they can form a mass in the chest, which can cause difficulty in breathing, and sometimes they cause an impedance block in the flow of blood which goes to the lungs. It causes an impedance to the flow of blood into the heart by the superior vena cava, or the vein which directs the blood flow from the head and neck region into the heart, and it gives rise to what is called the SVC syndrome. And the child can present with swelling of the head and the neck region, and this is just edema. They can also be swelling of the testicles because the cancer has reached there. If it goes to the CNS, you can have seizures, you can have difficulty in concentrating, you can have blurry vision, etc. So all these, as you can see, are very non-specific symptoms, and the parents need to keep a high degree of suspicion, and immediately when they see any of this, they need to approach the practitioner so that they may do some blood tests which can reveal that it could be a blood leukemia. So these are the symptoms, and then we do the blood tests. The treatment of blood leukemia is mainly chemotherapy or using agents which help us combat this condition. There may be other modalities also used, but they're not that important. For example, surgery. The surgery is not much used, except it may be used to put in an IV line, in a central IV line, which could be a central catheter or something called a portacat, so that the child doesn't need repeated prickings to collect blood for tests which may be needed in this condition, or to infuse blood or blood products, and or radiation therapy may be used. That again is not much used, except comes with chest swelling, which is causing a difficulty in breathing, etc. In which case, radiation therapy may be given to shrink the mass, or it is sometimes used as TBI or total body radiation before doing the stem cell transplant. And or, as I mentioned, chemotherapy, which is the use of various different agents in different combinations and at different times. Usually the treatment goes on for about 2.5 years, of which the first 9 months to a year are intensive, and then the rest is what is called as maintenance chemotherapy. This is what is used, and this helps. Now, this can either be used orally, it can be given intravenously into the vein, which goes directly into the bloodstream, or it can be given into the CSF or the cerebrospinal fluid. Now, of these, the CSF remains in the CNS, that is the central nervous system. It goes to the brain and the spinal cord, and the rest of it takes care of the bloodstream and the various organs which are supplied by the blood. And the other modalities that may be used is targeted therapy. For example, in a condition which is very rare in children, called chronic myeloid leukemia, we use what is known as tyrosine kinase inhibitors, which is TKI, which actually target the molecular fault in the cancer and remedy the disease. Or we could use immunotherapy, where you use CAR-T therapy to take care of the condition, and ultimately, if nothing works, then, or in some cases, even upfront, we may use a transplant, a stem cell transplant, which is followed by conditioning. The stem cell transplant are also different types. It can be autologous or allogeneic, and you transplant after conditioning. The care of the child has to be taken during and post-transplant, as it is an intensive treatment. So the message I would like to give to the caregivers of children is, when they see something wrong with a child, they should immediately take the child to a pediatrician or to a general practitioner and get the various tests done, and not delay it, because acute leukemia, the treatment has to be started almost immediately. You cannot wait, and unless it is started, it is not optimal. It doesn't work that well. So to bring immediately, and even when following treatment, to come as required, because the child may need treatment, as I mentioned earlier, for 2.5 years, and the treatment has to be given, say, on particular days, a particular chemotherapy agent, and it has to be followed accordingly. You cannot skip or modify it as per your whims and fancies. It has to be followed as per the protocol or the plan of treatment. That is, when the results are excellent if it is done well. So our hematology oncology section in the pediatric department at Lilavati Hospital takes care of chemotherapy of all kinds of diseases, not just hematology, that is leukemia, but also of solid tumors. And we have experienced people, including residents and nurses, and the full care is available here and is done very well. It is optimal. So a well-equipped and experienced department, consultants, the nurses and the residents would love to ease the discomfort and provide our services for any child who may suffer from cancers. Please do come and utilize our services. Thank you.